Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. I grew up in a healthcare family. My mother was a nurse. My father was an orthopedic surgeon. And back in the day, his generation of orthopedics did everything from hand surgery to hip replacements to back surgery. So it was just kind of part of the household culture. We knew that the phone may ring while we're eating dinner, and my father would need to talk to the hospital. Of course, this is back in the days before beepers or cell phones. And occasionally that led to dinner conversations about bodily functions that would be considered impolite by lay families. But that's just kind of what we grew up with. And so I sort of fell into this as a profession because I liked working with my hands, but didn't necessarily want to get my fingernails dirty. But one of the things that has helped me in my career is given me a perspective of 60 years of medicine. And coupled with some gray hair, I now see many patients who come in the office wanting another opinion. So they've seen 2 or 3 other doctors who have said, well, you need this done. Or the other one says, no, I wouldn't need this. And that gets hard to sort through. And occasionally I need to do that with my own family as we get into problems with the heart, problems with the kidneys, things that I know something about, but I'm not a subspecialist on kidney function or heart function. So I have to ferret through all that. So the message I would try to deliver to patients coming in is the first question is, was the person you saw qualified to give you an opinion? And, many times it's a well-meaning allergist, primary care doctor, heart doctor. And so again, they're speaking about something they know something about, but they're not really cutting edge doing this day to day. And so I tell patients, again, that may be a well-meaning opinion, but you're here now seeing a subspecialist. And if you want to see other specialists, I'll give you a couple of names of people who I knew do good quality work in the area, and you can go see them too. And I'm at the stage in my career where that I'm happy to give second opinions, and I do not mind if my own patients go get second opinions, because a lot of these problems are complex and there's no right or wrong answer. It's really a judgment call. So the first thing I would say is, are you seeing a spine specialist? And again, I'm in the first generation of what we would call spine surgeons. That is my group, us who trained in the 90s, trained in both orthopedics and neurosurgery. And in those two specialties have kind of come together, where in my father's day, he was an orthopedic surgeon, so he would do whatever bone work was necessary on the spine. And then the neurosurgeons would do the nerve work. And again, those two have come together. So particularly in the big cities, spinal surgeons are the ones who are delivering opinions. But if you're seeing a general orthopedic or a general neurosurgeon, that may be fine depending on the problem. But do know that there are probably more advanced trained people. So we want to get somebody who's able to deliver a qualified opinion. And the second thing I would say is also look for somebody has got some experience, and enthusiasm and care for the patient can't replace knowledge, but it is nice to have a practitioner who has, as they say, been around the block before, had cases go well, have cases not go well, because that's really where you test your skill set is managing through the difficult problems. And we all have them. I was curious, in one of our national organizations sent out a questionnaire, gave 3 case examples and asked, how would you treat this? How would you treat this? How would you treat this? And for some of these problems, there's just no consensus about the best way to treat it. And particularly if the problem is complex, meaning we're not just dealing with a neck problem and a pinched nerve, but there's also diabetes going on, or there's also an autoimmune disorder going on, or there's quite a bit of obesity, or there may be substance abuse going on, drinking too much. So those all come together to make the solution to the problem more difficult. And as I was telling one patient today, my Father's Day, they were giving gold injections into the joints to help arthritis because there was no such thing as anti-inflammatory medicines other than maybe aspirin. But gold was the gold standard for treating it. And before his time, the treatments were alcohol, nicotine. So nicotine was often dissolved in the alcohol, and that became a painkiller, and then cocaine. And so nicotine, caffeine, alcohol, cocaines were all used in various different forms in the past century to treat various pains. But fortunately, we've evolved since then. But anyway, so human beings are complex, and this is not a toaster, and that's why patients can go out and receive qualified opinions from different practitioners and get different answers. But at the end of the day, this is assuming physical therapy, anti-inflammatories, maybe injections or bracing haven't worked. So we're taking care of 90% of the problems have been treated with exercise and medication. And so the first thing I would also ask the patient, did you see somebody who knows how to do rehabilitation, who knows how to work with an injured body part, not doing surgery? And assuming they do, then we come down to surgery. And there's only two kinds of surgeries. There's unpinching, pinched nerves, and then there's joining together or fusing what we call unstable vertebra. So you have your spine, it's aligned like this. There's 33 bones going from the skull on down. If your bones are misaligned, if they're unstable, so it's shifted off to the side or translated forward, known as scoliosis or spondylolisthesis, that's when they need to be surgically joined together or fused. The question then becomes, well, how do we unpinch the nerve? How do we surgically fuse it together? And that's where the opinions go all over. And that's where the issues like obesity or autoimmune or diabetes come into play, because sometimes we'll want to do it with small, minimally invasive techniques, and sometimes it will be what we call an open technique. So as I try to counsel people, I would say, well, if you've established the credibility of the person giving you a diagnosis, are they spinal surgeons? Number two, do they know how to rehabilitate? Do they know how to do something other than operate, do surgery? Then I would just leave it at that and pick your carpenter and let them do what tools they think are best to work for you. Because just like I don't split hairs with my father-in-law's cardiologist about whether this pacemaker or the number of leads put in or the additional use of various medicines would be a good idea. I just have found somebody who I feel is competent. I trust them. Go take care of the problem. Use whatever tools you're going to use. And I would say the same thing to my patient. Find the technician, the carpenter that's going to do the work. Let them figure out whether this needs to be open, whether this needs to be minimally invasive, whether this needs a fusion, whether it doesn't need a fusion. But typically, it's nerve pain needs a nerve unpinched. And if the cause of the nerve pain is something out of alignment, then you got to put it back in alignment. That's my advice. That's my second opinion. And you are watching C-Spine. Like and subscribe. Thank you. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star? 'Cause I can play the part